Right now, inside your chest, your heart is either quietly protecting you or quietly failing you. And here's the terrifying part. You won't feel the difference. Not until a morning when you can't get out of bed the way you used to. Not until a Tuesday afternoon when you lose your balance on the stairs. Not until a night when you wake up gasping, and nobody is there. If you're over 60, your heart changes every single year. The walls thicken. The valves stiffen. The electrical signals slow. After 65, the risk of heart failure doubles every decade. And yet most seniors only check their heart once a year, at a 15-minute appointment where a doctor listens for 8 seconds and says, "Sounds good." That is not enough. But what if you could check your own heart, right now, without a single bill, without a waiting room, without anything more than your hands and your attention? You can. And today I'm going to show you exactly how. In 3 decades, I've reviewed thousands of patient files. And one pattern appears again and again. People who caught their heart problems early lived better, longer, more independently. People who waited often wish they hadn't. I've seen this too many times. That changes today. By the end of this video, you will know 7 ways to check your heart at home, each one taking under 60 seconds, each one backed by real clinical science. Some of these you can do right now, sitting in your chair. Others take a week of simple tracking to reveal their full picture. I need you to stay for number 7. Because number 7 is the home check that cardiologists use in clinical settings, and almost no senior knows it exists. Let's begin. Before we go further, type your age and city in the comments right now. And if you've had any heart concerns in the last 12 months, type the word heartstrong below. Because this video was made for you. Most seniors check their pulse occasionally. They count the beats. The number seems fine. They move on. But here's what no one tells you. It's not just the speed of your heartbeat that matters. It's the rhythm. Here is the mechanism your doctor rarely explains. Your heart is controlled by an electrical system. In a healthy heart, that signal fires with precise, consistent timing, every beat evenly spaced from the last. But when the heart's electrical conduction system becomes disrupted, due to inflammation, arterial stiffness, or progressive fibrosis of cardiac tissue, beats can arrive irregularly, randomly, sometimes with a long pause, then a sudden double beat. This is called atrial fibrillation, A-Fib, and it is the most common serious heart rhythm disorder in adults over 65. A-Fib dramatically increases stroke risk. According to the American Heart Association, adults with undetected atrial fibrillation have up to 5 times the normal risk of stroke. 5 times. And most people with A-Fib feel nothing. Mrs. Gloria Jennings, 71, a retired bookkeeper from Kentucky, had been checking her pulse for years. Always around 68 to 72 beats per minute. Normal. Fine. But one morning her daughter noticed her mother counting and recounting, confused. The rhythm kept changing. Some beats were close together. Others had a long pause before them. A same-day EKG confirmed A-Fib that had likely been present for months. A small blood thinner prescription may have protected her from the stroke that was quietly building. If someone had told her to check the rhythm, not just the rate, she might have caught it sooner. Place 2 fingers on your wrist pulse. Close your eyes. For 30 full seconds, notice the spacing between beats. Is it perfectly even, like a clock ticking? Or does it feel irregular, with beats arriving randomly or in clusters? Do this every morning for 2 weeks. Any persistent irregularity, 3 or more days in a row, is a non-negotiable conversation with your doctor. Do not self-diagnose. But do not dismiss an irregular rhythm as probably nothing. And if your pulse can reveal that much, wait until you discover what your eyes are telling you about your cardiovascular system. You look in the mirror every morning. You check your hair, your face, your reflection. But you've never used that mirror to check your heart. Here's what no one tells you. The whites of your eyes, called the sclera, contain a dense network of tiny blood vessels. These vessels respond directly to systemic circulatory health. When inflammation, elevated cholesterol, or cardiovascular stress is present, those vessels can display visible changes. Look specifically for two things. First, tiny red lines or burst vessels in the white of the eye that appear without any injury or eye strain. Persistent or recurring subconjunctival hemorrhages, particularly in older adults, can be associated with uncontrolled hypertension and elevated intracranial pressure. Second, a pale or yellowish tint to the sclera combined with pale inner eyelid tissue, which can indicate anemia, a reduction in red blood cell capacity, that places increased workload demand on the heart. The heart compensates by increasing cardiac output, accelerating cardiovascular wear. A peer-reviewed study published in a cardiovascular journal found that visible microvascular changes in the eye were correlated with early-stage hypertensive damage to the heart and kidneys in a significant percentage of older adult patients. Mr. Calvin Reed, 74, a retired firefighter from Georgia, dismissed the faint red vessels in his eye as a reaction to wind or tiredness. He'd had them for 3 months. When his internist finally examined them alongside a blood pressure reading of 178/96, the combination pointed to hypertensive crisis that had been building silently. His vision in that eye had already begun to subtly decline. Each morning in natural light, pull down your lower eyelid and look at the inner lining. It should be a healthy deep pink. Pale. Note it. Then look at the full white of each eye. Recurring red vessel bursts without explanation, or consistent yellowing, are worth immediate evaluation. Track any changes for 5 consecutive mornings. Photograph if you can. Talk to your doctor. Do not adjust blood pressure medication independently. That was your eyes. Now let's go to something even simpler, something in your legs. This one takes less than 10 seconds. Look down at your lower legs and feet. Do you have hair on your lower legs and feet? Or has it slowly disappeared over the years? Here's what no one tells you. Hair loss on the lower extremities, particularly on the feet and shins, is not just a cosmetic change with age. In seniors, it is often a clinical indicator of peripheral artery disease, or PAD, a condition where arterial narrowing reduces blood flow to the legs. The mechanism involves progressive atherosclerosis, plaque buildup, in the femoral and popliteal arteries. As circulation diminishes, hair follicles in the lower extremities lose their blood supply. Without adequate oxygen delivery and nutrient perfusion, hair simply stops growing. This same narrowing that affects your leg arteries frequently signals narrowing in the coronary arteries, the vessels that feed your heart. PAD and coronary artery disease share identical risk factors and often occur simultaneously. According to research reviewed by the Cleveland Clinic, peripheral artery disease is present in a significant percentage of adults over 65, and the majority are undiagnosed. Mrs. Dorothy Vance, 69, a retired postal worker from Mississippi, had noticed her lower legs were completely smooth for nearly 4 years. Her feet were often cold. She had occasional cramping when walking, which she attributed to her shoes. A simple ankle brachial index test performed in her doctor's office confirmed severe PAD. Imaging later revealed significant coronary narrowing. She had been one vigorous walk away from a cardiac event. She had no idea. Examine both lower legs and feet. Compare leg hair density to your arms. Note any skin that appears shiny, thin, or unusually smooth. Note any persistent coldness in the feet or cramping in the calves during walking. Report even one of these findings to your physician. Do not ignore cold feet. That is not just poor circulation in a general sense. It may be a direct window into your heart. But what about something even more immediate, something that happens every time you simply get up from your chair? You stand up. Maybe you feel a slight head rush for a second. Most seniors consider it normal. But here's what no one tells you. That moment, the instant you rise from sitting, is one of the most cardiovascularly revealing transitions in your entire day. When you stand, approximately 300 to 500 milliliters of blood shifts toward your lower body under gravity. A healthy cardiovascular system compensates within 1 to 2 seconds. The baroreceptors in your carotid artery and aortic arch detect the blood pressure drop and immediately signal the heart to increase rate and signal the vessels to constrict, restoring cerebral perfusion before your brain even registers a change. But in older adults, this reflex slows. Baroreceptor dysfunction, a gradual impairment of these pressure-sensing mechanisms, is extremely common after 65 and is dramatically underdiagnosed. The resulting condition, orthostatic hypotension, is defined as a drop in systolic blood pressure of 20 millimeters of mercury or more within 3 minutes of standing. Johns Hopkins researchers have linked orthostatic hypotension in older adults to increased risk of falls, fainting, stroke, and accelerated cognitive decline, because the brain is repeatedly experiencing brief oxygen deprivation. Every time you stand up. Every single day. Mr. Arthur Benson, 76, a retired accountant from Wisconsin, had been falling every few months for 2 years. Each fall was explained away: loose rug, wet floor, misjudged step. But when his physician tested his blood pressure lying down at 138/82, and then immediately standing at 108/64, the 30-point systolic drop told the whole story. His brain had been starved of blood flow dozens of times a day, creating unsteadiness he experienced as clumsiness. He wasn't clumsy. His heart was struggling. You need a home blood pressure cuff, available for under $30 at any pharmacy. Lie down for 5 minutes. Take a reading. Stand immediately. Take another reading at 1 minute, and again at 3 minutes standing. A drop of 20 points or more in systolic pressure on multiple days is a direct referral conversation with your doctor. Rise slowly. Grip something stable. Stay hydrated. And report this finding. It can prevent the fall that changes everything. We're halfway through. And the next check involves something you do every single night without a second thought. You go to bed. You stack your pillows and drift off. You've never thought to count them. But here's what no one tells you. The number of pillows you need to feel comfortable lying down is a clinical indicator that cardiologists actively track. Here's the mechanism. During the day, fluid accumulates in the legs due to gravity, especially in seniors with reduced cardiac output. When you lie flat at night, that fluid redistributes from the legs back into circulation, and in compromised hearts, excess fluid backs up into the pulmonary veins, raising pressure inside the lungs. This condition is called pulmonary venous hypertension, and it produces a specific recognizable symptom, breathlessness when lying flat, called orthopnea. To relieve it, the body naturally seeks elevation. You add a pillow, then another, then a third, and you tell yourself your mattress got softer, or your neck prefers it now. Researchers at the National Institute on Aging have noted that progressive increase in sleeping pillow elevation, without an orthopedic reason, is among the most ignored early warning signs of evolving heart failure in older adults. Mrs. Sylvia Marchetti, 72, a retired school administrator from New Jersey, had gone from sleeping on one pillow to 4 over 18 months. She told friends it was a personal preference. She mentioned it to no doctor. When her daughter finally insisted she get checked after noticing her mother waking up breathless at 2 a.m., her echocardiogram revealed elevated left ventricular filling pressures. She had compensated heart failure that had been signaling silently for over a year. Ask yourself honestly, how many pillows do you sleep on tonight compared to 2 years ago? If the number has increased by 1 or more, and there is no neck or back injury driving the change, this is a cardiovascular discussion, not a comfort preference. Tell your doctor. Mention the word orthopnea. Watch how quickly their attention sharpens. 2 checks remain. Do not leave now. Take a slow, normal breath. Now hold it. How long can you hold it comfortably, not forcing, not straining, before the urge to breathe becomes strong? Most seniors have never thought to measure this. But here's what no one tells you. Breath hold tolerance is a proxy measure of several interconnected cardiovascular and respiratory factors. Oxygen saturation baseline, lung compliance, tidal volume efficiency, and your body's sensitivity to rising carbon dioxide levels. As heart function declines, cardiac output falls. Less blood reaches the lungs per cycle. Oxygen-carbon dioxide exchange becomes less efficient. Oxygen saturation at rest may still appear acceptable, but functional reserve, the depth and quality of that reserve, quietly shrinks. In clinical settings, exercise oximetry and respiratory function tests measure this. But a simple informal breath hold baseline, tracked consistently over 2 weeks, can reveal a declining trend long before formal testing would detect a problem. A peer-reviewed study from a major respiratory medicine journal found that significantly reduced comfortable breath hold duration in older adults correlated with reduced cardiac ejection fraction and elevated risk of exertional cardiac events. Mr. Theodore Kimura, 70, a retired engineer from Washington State, noted casually that he couldn't hold his breath as long as he could 5 years ago. He mentioned it to his doctor only because he read it somewhere. His physician ordered a simple spirometry test alongside a cardiac stress assessment. Both revealed meaningful decline. Early intervention followed. His casual observation may have extended his life. Sitting comfortably, take 1 normal breath in. Hold it. Start a timer. Stop when the urge to breathe becomes moderately strong, not maximum. Record your time. Repeat 3 mornings in a row and average the result. Under 20 seconds of comfortable breath hold in a resting, non-athletic older adult is worth discussing with your physician. Do not strain. Do not force. This is an observation, not a competition. Track the trend. If it's declining week over week, that trend matters. And now the 7th check. The one I promised. This is the one most seniors have never heard of. And it may be the most powerful home heart check that exists. Here's what no one tells you. It's not how hard exercise makes your heart work. It's how quickly your heart recovers afterward. That recovery speed, what cardiologists call heart rate recovery, is a direct measure of autonomic cardiovascular function, parasympathetic tone, and overall cardiac reserve. Here is the mechanism. After physical exertion, a healthy cardiovascular system rapidly withdraws sympathetic nervous activation and restores parasympathetic balance. The heart rate drops quickly, efficiently, and predictably. But when the heart is under stress, due to arterial stiffness, reduced ejection fraction, inflammation, or autonomic neuropathy, this recovery slows dramatically. The heart stays elevated. It cannot come down. Research referenced across multiple institutions, including Harvard Medical School, has consistently identified heart rate recovery as one of the strongest independent predictors of cardiovascular mortality in adults over 60 stronger, in some studies, than resting heart rate, cholesterol levels, or even blood pressure. Mrs. Frances Dalton, 67, a retired nurse from Colorado, believed her heart was in good shape because her resting rate was 64. But when she climbed 1 flight of stairs and sat down for 60 seconds, her heart rate had only dropped by 6 beats. She knew the number should be higher. She was a nurse. That single observation sent her directly to her cardiologist. Imaging revealed significant left anterior descending coronary artery narrowing. She underwent a procedure within 3 weeks. She credits that 1-minute test with saving her life. Sit quietly for 5 minutes. Check your heart rate. Walk up 1 full flight of stairs 10 to 15 steps, at a steady continuous pace. Not sprinting. Not slow. Continuous. Immediately sit down at the top. Start a timer for exactly 60 seconds. At 60 seconds, check your heart rate again. Calculate the drop. How many beats did your heart rate fall in that 1 minute? A drop of 12 or more beats is reassuring. A drop of fewer than 12, consistently, across multiple tests on different days, is a signal your cardiovascular system is struggling to recover. Use it every week. Track the number. Watch the trend. And if the number is consistently below 12, do not wait for your annual appointment. Call your doctor. Do not perform this test if you have been advised to avoid exertion, or if you have unstable symptoms. Consult your physician first. 7 checks. Every single one available to you right now at home at no cost within minutes. Let me walk back through them. Check your pulse rhythm, not just the rate. Check your eye whites for vascular and circulatory signals. Check your lower leg hair, a window into arterial health. Check your sit-to-stand blood pressure before the next fall happens. Count your sleeping pillows and ask honestly if that number has grown. Measure your comfortable breath hold and watch the trend. And perform the Stair recovery test, because heart rate recovery tells a truth that resting numbers never will. 7 checks. 7 windows into a heart that is either thriving or quietly asking for help. This isn't fear. This is power. The power to notice. The power to ask. The power to act before something becomes irreversible. Here is your 14-day challenge. Each morning for the next 2 weeks, perform at least 2 of these 7 checks. Write down what you find. Note any trends, changes, or surprises. At the end of the 14 days, bring that log to your next physician's appointment. You will walk in as an informed patient. That changes everything. Drop cardiac clock in the comments if you're starting the 14-day challenge today. Share this video with someone you love who is over 60. Not because they're sick, because they deserve to know this. And subscribe because next time we're covering the 7 foods that are silently stiffening your arteries after 60, and the 3 morning swaps that may begin reversing that process within weeks. Take care of your heart, because your heart is taking care of everything else. I'll see you in the next video. Medical disclaimer. This content is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider before making changes to your health routine. Do not start, stop, or modify any medication without physician guidance.